Okay.
You want to show
No, that is not. This is enough for now.
Okay.
Hello. Hello.
Yes, sir.
Can you hear me?
Yes, sir.
Yes, sir.
Okay. We will continue. Okay. Can you see the slides? PPT slides?
Yes, sir.
Yes, sir. Yes, sir.
Okay. Yesterday we have stopped at antibiotics. That we have studied actinomycin D. Now the next antibiotic is bleomycin. It is used in testicular tumors, squamous cell carcinoma, oral cavity, head and neck carcinoma, gastrourinary tract, gastric and genitourinary tract, and Hodgkin's disease. Astrodrug reactions, mucocutaneous toxicity, pulmonary fibrosis, myelosuppression, allergic hypotension. Now, after knowing this drug, next drug is miscellaneous. It is not fitting into any of these categories. Antibiotic, alkylating, etc. etc. Hydroxyurea. Now, this hydroxyurea, it blocks the conversion of RNA to DNA. How exactly? By inhibiting the enzyme ribonucleoside diphosphate reductase. What is the result? It will interfere with the DNA synthesis and exerts S phase site cell specific action. Uses chronic myeloid leukemia, cirrhosis,
This type of problems happen sometimes. Can you check, sir? This phone.
Hello.
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
There was a drop in the power, so there was no Wi-Fi. Now can you see the slide?
No, sir.
You can't see the slide?
No, sir.
No?
I think,
No, ma'am. No, ma'am.
you have to reload it. Reload.
No? Now can you see?
Yes, ma'am.
Yes, ma'am.
Okay then. Now another drug. That's what we're discussing about hydroxyurea. Next drug is asparginase. This enzyme is obtained from E. coli. It degrades L-aspargine to L-aspartic acid. By doing so, it will deprive the leukemic cells an essential metabolite and cause the death. Uses acute lymphoblastic leukemia. Adverse drug reaction, hyperglycemia, increase of triglycerides, pancreatitis, liver damage, clotting defect, CNS symptoms and allergic reactions. Next comes the another group of drugs which are called targeted drugs. Now you know major there are three groups. One is cytotoxic drugs, second one is targeted, third one is hormonal drugs. So we have completed cytotoxic drugs. Again in that there are about 7 or 8 different varieties we have covered. Now targeted drugs. So what do you mean by that? There are selected targets which can be attacked by these drugs and they will selectively kill or inhibit the cancer cells. So on the cancer cells, there are certain targets. By hitting that target, either they will kill or inhibit the cancer cells. And these target cells, there are two types. One is called monoclonal antibodies. And these drugs, these monoclonal antibodies should be given parenterally, intravenously. Then they will attack the target. Where is the target? It is on the cell surface. The target on the cell surface or on the tumor. There are tumor antigens which are responsible for the tumor. So here, this for monoclonal antibodies, the targets are cell surface targets or tumor antigens, and these should be given parenterally. The next drugs, which are synthetic small molecular components. That means they are chemical substances synthesized. They have small molecular substances and these are given orally. When they are given orally, they will penetrate the cells, all the cells, and particularly affect cancer specific enzymes or pathways. They will affect the cancer specific enzymes or pathways. So these are two types of substances which are called target drugs. In that, what is called as BCR-ABL tyrosine kinase inhibitor. So these drugs in general belongs to a family what is called as tyrosine kinase protein inhibitors. In that, depending upon the specific target, they have been called BCR, ABL, etc. So this, what is this BCR-ABL? This this is expressed by chronic myeloid leukemic cells, and these are the receptors for tyrosine protein kinase enzymes. So by inhibiting that, it acts as anti-cancer drug. Uses chronic myeloid leukemia, dermatofibrosarcomas. That means these are the cells, they produce these specific types of target tyrosine kinase proteins. Adverse reaction: abdominal pain, vomiting, fluid retention, periorbital edema, pleural effusion, myalgia, liver damage, CCF, etc. Next target, what is called as EGF. What is that EGF receptor? It is nothing but epidermal growth factor receptor. Epidermal growth factor receptor. It is also called HER1 receptor. That is human epidermal growth factor 1. Now, what is this EGF receptor? It is a transmembrane receptor. What is the type of receptor? Again, tyrosine protein kinase receptor. What is the function? It will regulate growth and differentiation of epithelial cells. So this is the overall mechanism of action of this EGF receptor inhibitor. What is the drug? It is called gefitinib. Gefitinib. What is the particular? It penetrates the cells, binds to tyrosine kinase domain of epithelial growth factor receptor and prevents the phosphorylation. So this phosphorylation, it is a regulatory protein. Can you hear me?
Yes, sir.
Because there is heavy rain and that is the external noise. I cannot avoid that. Uses small cell carcinoma of lung, adverse reaction, skin rashes, diarrhea, interstitial lung disease, etc. Now HER2 inhibitor, that is trastuzumab. Trastuzumab. It will bind to extracellular domain. Earlier one, it is transcellular membrane domain. It is extracellular domain of HER2. What is the mechanism? It will inhibit the signal transduction. In addition, there is immune cell mediated cytotoxicity is also seen. Cytotoxicity, immune cell mediated. Uses carcinoma of breast, stomach. Adverse reactions, flu-like symptoms, chills, fever, malaise, back pain or neck pain, dyspnea, cardiomyopathy. Next is angiogenesis inhibitors. This is also a target. What is the target? Angiogenesis. That means formation of new blood vessels. This is required for any growth. Blood is required, blood supply is required. Similarly, metastasis, wherever the cancer cells are spreading, it should have a rich blood supply. So this is called VEGF. What is that VEGF? Vascular endothelial growth factor. So this is the factor which is responsible for the proliferation of new blood vessels. VEGF, vascular endothelial growth factor. That is the target here. What are the drugs? Bevacizumab. Bevacizumab. It will bind to VEGF-A and its access to VEGF receptor is blocked. So that will interrupt the angiogenesis signal. Uses metastatic colorectal carcinoma, small cell lung carcinoma, breast carcinoma, clear cell renal carcinoma. Adverse reactions: hypertension, thromboembolism, cell injury, heart attack, strokes, hemorrhage, gastrointestinal perforation. Next group of drugs, proteasome inhibitors. So here the target is proteasomes. What are these proteasomes? Proteasomes are packed complexes of proteolytic enzymes. They are packed complexes. And these proteasomes, they degrade several intracellular signaling proteins. So what these intracellular signaling proteins do? They will control the cell cycle, they will control apoptosis, and they will control the survival response. So these are the proteasome inhibitors. Examples: bortezomib. Bortezomib. It will prevent the breakup and degradation of one factor. What is this? It is called nuclear factor Kb. It will prevent and breakdown of degradation of IKB so that nuclear factor Kb is not released to transcript the cervical molecules. Uses multiple myeloma, mantle cell lymphoma, peripheral neuropathy, diarrhea, bone marrow depression. Next target, CD20 inhibitors. Now what is this CD20? It is an antigen. So certain malignant cells, they express certain antigens on their surface to which monoclonal antibodies are developed. So this CD20 is one such antigen. So they prevent these antigens. Why? These antigens, they are present on the surface for which monoclonal antibodies are attached. Now you are trying to preventing this, inhibiting this CD20 antigen. Which are the drugs? Rituximab. It will bind to CD20 B cell expressed on the cell surface of the P lymphocytes, plasma cells. As a result, it will promote apoptosis. Uses B cell lymphoma, non-Hodgkin's lymphoma, chronic lymphoid leukemia, and some autoimmune diseases. Adverse reaction: chills, fever, urticaria, rashes, pruritus, dyspnea, hypotension, etc. Next group of drugs, hormonal drugs. It is the third major group. These drugs, they are not cytotoxic, but they modify the growth of hormone-dependent tumors. Which hormone? Sex hormones, estrogen, progesterone dependent tumors. And these drugs, they are only palliative. Try to reduce the recurrence or try to reduce the size of the tumor. Now what are these hormonal drugs? First and foremost is corticosteroid. Example, prednisolone, dexamethasone. Why these corticosteroids are used? Because they are lympholytic in action. Destruction of lymphocytes, lympholytic. They are used in acute and chronic leukemia, then lymphomas, Hodgkin's, breast cancer. In addition to that, in addition to lympholytic activity, These corticosteroids are also valuable for malignancy and chemotherapy associated complications. What are these complications related to malignancy and chemotherapy? Hypercalcemia, hemolysis, thrombocytopenia. For that also, this is beneficial. They give symptomatic relief as antipyretic, mood elevating, and potentiation of anti-emetic actions of ondansetron. For all these chemotherapy or malignancy related complications, corticosteroids are used. Next is estrogens, estrogen hormone. In general, estrogen hormone, it will give the symptomatic relief in carcinoma prostate cancer. In that, there are 3 types of drugs, estrogen related drugs. One is called SERM, SERM, selective estrogen receptor modulators. Selective estrogen receptor modulators, SERM. Example, tamoxifen. Next drug, selective estrogen receptor down regulators. This is called SER down regulator. Example, fulvestrant. And the third group, aromatase inhibitor. Example, letrozole. Now all these drugs are adjuvants and palliative for carcinoma breast, particularly when it is an hormone dependent breast carcinoma. Next is anti-androgens. Example, flutamide, bicalutamide. They will antagonize the androgenic action on CA prostate. Next is gonadotropin releasing hormone agonist. What is their action? Indirectly inhibit androgen secretions by suppressing follicle stimulating hormone and lutein. Uses palliative effect on CA breast and prostate. Now, you may be wondering how to remember all these drugs. In your syllabus, there is only a superficial knowledge about anti-cancer drugs, about their general principles, general toxicities, toxicity amelioration, and classification of the drugs. You should know their classification. Then particularly you should know the drugs which are used for the treatment of leukemias. Different types of leukemias, acute, chronic, lymphoid leukemias, Hodgkin's, non-Hodgkin's, etc. Specifically, you should know about those drugs, and remaining drugs for your overall knowledge, they are included. Any doubts? Hello? Any doubts? With this, we have completed the topic on anti-cancer drugs. What is this?